I'm Kelly Mayer, licensed clinical social worker, and today I wanted to talk to you about starting therapy. So a lot of times people are very nervous to start therapy. Maybe you've never been in therapy before, you've kind of seen it in the movies, and you may have kind of a misperception of just what it's going to be like. It can be really scary for a lot of people to start therapy because you're kind of being vulnerable and just putting yourself out there. But therapy is a really safe place to just go ahead and talk about anything that's on your mind. So with my clients, I like to tell them, I'm just here to help you. And a lot of times clients are going through lots of different issues and they're feeling very overwhelmed. And therapy is just, it's a scheduled time when you can sit down and talk to a professional about what's been going on in your life, what's on your mind. Maybe there are things that you're too embarrassed to talk to friends or family about. And that's really the key for where therapy can be so beneficial because the therapist is a neutral party. They don't know you in real life. They don't know your friends or your family. They're not really going to run into you in real life. They're just here to talk to you in a non-judgmental way, to try to listen, to try to offer solutions, and to try to teach you different tools that are research backed to try to help alleviate some of the symptoms that you're having. A lot of times people have questions about confidentiality. So as a therapist, we have a code of ethics and we take confidentiality very, very seriously. That is one of the hallmarks of our profession as therapists is confidentiality. So anything that you say in the session is confidential. We are not allowed to talk about you or give your name or give identifying information to other people. Most therapists, we're really drilled this in school. So we do the session, we focus on our clients, and afterwards we just kind of leave the session where it is and we go about our regular life. And so with confidentiality, there are a few exceptions to that are required by law. So first of all therapists are mandated reporters. So if you mention anything about child abuse, child neglect, or abuse and neglect of a disabled person, we are required to report that by law, and that is to ensure that we're protecting children and vulnerable people. The other exception to confidentiality is suicide intent, suicide plan. So for clients that verbalize, being suicidal, we go ahead and we do an assessment during the session, and we focus on, suicidal thoughts, suicidal intent, and suicidal plan. And so the therapist will make an assessment, and if the therapist really believes that the client is in immediate danger, that they are going to go ahead and kill themselves, then we are required by law to break confidentiality, and that is to protect our clients, because we never want any client to kill themselves. So we go ahead and we would go through all the proper procedures to making sure the client's safe. And with that, the same thing also applies for homicidal intent. So if we have a client that is telling us that they are, right after the session, they are going to go ahead and they are going to kill their brother, we are required to notify local the police department of that to make sure that does not happen. And then, so those are really the main things. Really, the only exceptions to confidentiality is basically to protect people and to save lives if there is this immediate danger situation. Occasionally, therapists will be subpoenaed by court order. It's very, very unusual, but it does happen sometimes where therapists might get a subpoena and then they have to break confidentiality. But in those cases, we're basically just supposed to reach out to legal consult and find out what exactly we're supposed to do. Because of course we always have to follow the law. But as far as those exceptions, which they really don't happen very often, most of the time those situations don't really happen that often, unfortunately. We do hold confidential everything that is said in session. So I've had clients, if they have things they want to talk about their spouse, their children, their family members, things going on at their workplace, even very highly sensitive matters at their workplace that can't get out to the public, that's perfectly fine because of confidentiality. So, as therapists, we really like our clients just to feel comfortable being open and honest with us, and just letting us know, anything that's really going on in their lives. Because we're not here to judge. We're here just to try to help and try to assist them to get through whatever these difficult times are. I do have a lot of clients, sometimes they feel a little bit embarrassed telling me things. And so for that, I just like to say, as therapists, we've really heard everything. We've heard all kinds of stories. We've heard all kinds of terrible things that have happened, terrible things people have said, or thoughts that are, really not very nice. And so, pretty much anything that you might be hesitant to talk about in a session, most likely your therapist has already heard these things. And so I just always like to tell my clients, like, no matter what you tell me, I probably have heard something worse. So there's no judgment. You can really just tell me what's ever on your mind, and we'll just go ahead and talk about it. And I'll ask questions about what you're saying, and I'll do my best to try to understand, where you're coming from, and what your goals are, and kind of just collaborate with the client on these goals to try to help them achieve whatever it is that they're trying to work on. So those would be my main tips for starting therapy, is just, ask questions of your therapist. If you want to know about their background, their training, their client populations, which disorders they've worked with, if they've gone to any interesting like continuing education trainings or any interesting conferences. You really just want to ask some questions just to make sure that whatever issues you want help with, that your client is very experienced in those areas, and that they have had clients with similar issues, because that's going to not only give them the textbook training, but also the real life experience of dealing with other clients with those same issues. And that's always very helpful, because as a therapist, sometimes I can kind of think back to a client that was similar to maybe a client that I currently have, and I can think about what types of techniques or tips that I did with that past client that were really helpful, and I can kind of use those right off the bat with a new client that's having similar issues, and kind of use that to help troubleshoot. And of course, no two people are the same, so I like to use different types of techniques. But it is helpful when starting therapy just to find out information about your therapist, and make sure that they're really trained in whatever areas that you're needing help with. And then, just continuing to just build that rapport with your therapist, build that trust and that honesty and that openness, which it does take time. You're not going to feel comfortable, right off the bat, maybe sharing some very personal information with your therapist. And that's fine. We don't expect that as therapists at all. We know that it's difficult to start therapy. And we try to be patient. At least I try to be very patient with my clients, and just let them know, if there's something they want to talk about in a future session, that's fine. If they're not ready to talk about trauma or just certain topics that, I'm very patient, and I'll just wait until they feel comfortable with me, and we feel like we've really developed that trust, really into our relationship. And with starting therapy also, I do always recommend, it's great to get a notebook and a pen for your sessions, because sometimes you might be talking about something and you may be like, oh, that's really good. I never thought of that before. And those are the opportunities. It's so helpful if you as a client have a little notebook and you can kind of jot these notes down, because you may have some big breakthrough discoveries during the session. And then, I would hate for you to then kind of forget about it afterwards. So a notebook can be very helpful just to kind of write down some notes. Also, I know I like to give homework, and most therapists give weekly homework in between sessions. So that notebook will give you an opportunity to write down homework. A lot of times homework might be like answering different questions or different types of journaling. So you can write that in your notebook as well. And then later on, when you're starting to feel better, you can look back and you can kind of see how far you've come. You can see all your homework assignments. And then once you're discharged from therapy, because you're doing better, you have that notebook. And if ever, you're struggling with the same kinds of issues like depression or anxiety, you can always pull that out you can reread some of these things that were so helpful in the past. So I do think just like having a notebook and a pen, maybe just like some water, something that's going to make you feel comfortable during the sessions, and just having like a nice quiet place that's private, so that way you feel comfortable opening up and you don't have to worry about, family members hearing you. So those are just some of my basic tips for starting therapy, and hope you found this video to be helpful.